Good afternoon, Karibuni. My name is John Githongo, publisher of The Elephant, and I'm very honored today to have with us my friend and one of Kenya's leading public intellectuals and political scientists, Professor Karuti Kanyinga, who also happens to be director of the Nairobi University's Institute for Development Studies, IDS, which is I think Karuti, it is the oldest institute of development studies in the world. It's older than Sussex and all the others. It is the grandfather of all development studies institutes on the planet.
Actually, we are the grandfather in many ways because started in 1965 with funding by the Americans. And the most interesting thing is that we have a history that very few people have bothered to remember. IDS was formed to start looking at what was happening in the colonies. And the Americans had a lot of interest in Africa and Latin America. So it is possible that our first director at IDS was a CIA fella.
Okay.
With a lot of funding actually to look at the economic aspects of post-colonial societies. This was being revealed much later when other researchers came to realize that he had come from the Rand Corporation in America. So there was a lot of history there, and very soon, actually, we are writing this particular history. I'm trying to talk to different people to see how best to tap into their archives. We are also older than Sussex because it started in 1965 to specifically look at that particular question of post-colonial Africa and the type of economic and social developments that were taking place. With a view to trying to have policies that would help in development, but we suspect the West and African governments were thinking differently about these institutions for development studies.
Yes.
And that's how Sussex actually was born also in 1966 after IDS Nairobi, for them to produce theories as we deal with the practice of development. So we began as an institute that is focused to deliver on development and shape development patterns, whereas they would theorize on development in the North. Okay. And that's how come we are actually the Institute for Development Studies,
okay,
as opposed to Sussex, which is an Institute of Development Studies. I usually tell people that we are for development studies, and for is not a typo, which many people think is a typo.
Yes.
Because of Institute of Development Studies. So it's not a typo, it's deliberate that we are an Institute for Development Studies, yes.
Thank you, thanks Karuti.
I also mentioned that we have been, IDS Nairobi has been housed quite a number of Nobel laureates, people like Stiglitz, Peter Lewis. Oh, yes.
Joseph Stiglitz came through the IDS?
Yes, Joseph Stiglitz was at IDS, Peter Lewis was at IDS, and quite a number of others. People who shaped what was called actually the Kenya debate of the 70s was born at IDS. The debate on whether development can take place in the periphery was just at IDS with data by many people actually producing data from East Africa and trying to reflect on what that data meant for development. That's a story for another day.
But it's an important story to be told. But you know, I was remiss because I forgot to start by asking how you're doing. We are all physical distancing. Our movements are restricted. Are you in Nairobi County, Karuti? And how are you and your family doing?
Let me say I'm doing all right, and I am locked in Nairobi. I mean, the restriction of movement caught me when I was already in Nairobi. I had not traveled up country, and so the restrictions caught me ready in Nairobi. And I would say that I'm doing well, but there is also the fatigue of staying indoors most of the time, because you ask your friends for a meeting, of course everybody wants to meet online.
Yes.
Not anywhere else. There isn't much that people are doing that's other than having meetings online and that kind of thing.
Okay.
Yeah. So I would say that I'm doing all right. And of course, with the challenge of not meeting all friends physically, as we have always done, to have discussions like the one we're having now.
Good, good. Thank you. I'm glad to hear that. Stay safe.
Thank you.
Prof, can you give us your analysis of the political impact of the coronavirus COVID-19 on Kenya's political terrain already? I mean, one of the things that has been noteworthy and has been commented on in social media fairly extensively, especially, is this very loud silence that we, that our political class has been able to dominate basically public space with political noise, and the public follows them to and fro. But they're silent now. I think this COVID obviously is something which they're still sort of coming to terms with. But more substantively, what would you say are some of the impacts on Kenya's sort of political economy now and as this pandemic continues to play out?
Thank you very much. Let me begin by pointing out that coronavirus actually is not impacting on healthy systems alone, and therefore it doesn't take the form of a health problem alone. You notice from how people are responding everywhere across the world that it's also a governance issue. It's also raising issues to do with the socio-economic aspects of the society.
Yeah.
And therefore, it's not something that we should look at from a health systems point of view. It is testing healthy systems, but in our context, actually, across Africa, it is testing even the political system. It's testing our social fabric as a society. Let alone the economic order that has been disrupted completely. In Kenya, there is something that is very interesting since our first case of coronavirus. I've never known politicians to be scared the way they seem to be scared of this virus. All of them disappeared. And they disappeared actually in a manner that we haven't seen many of them coming back, not even on social media. And I'm saying this not with a light touch. I'm very serious that for the last 2 years, politicians in Kenya have dominated every single space that has been available. Whether it's economic policy discussions, whether it's political reform discussions, name it. They have been there with a lot of divisive rhetorics. But with coronavirus, I mean, they have disappeared, and some of them are attempting to come to the fore. And when they come, they look very incoherent. Some are even wearing suits to issue a press statement, and they're not leaving their house. Others are waking up very early in the morning wearing a suit as if they're going for a meeting, only to realize, no, there is lockdown, and they stop at that. So it's really getting politicians in a very interesting corner, which is good for our society, I must admit, because we have a class of politicians that do not have public good in their mind. And I want to emphasize the point that coronavirus, COVID-19 really, the responses to it are responses that require a lot of attention in terms of delivery of public good. Our politicians are much more concerned about the delivery of what we can call self-interest goods.
Yeah.
Mm-hmm. All along, and they personalize issues. There is always the question of what do I do to get political capital and satisfy my personal interest in this or that. But coronavirus has actually showed that whatever you do, it must be seen from a public good point of view. And since our politicians are not wired, if I can say that, to respond to public good and give people what is commensurate with public good, they are completely lost, right? But the most interesting thing is that it's not Kenyan politicians alone.
No.
When you look across the continent, you see almost the same kind of response, politicians disappearing. I think it's in Ghana, where the opposition is also telling people, wash your hands the way as if you have touched the t-shirt of the ruling party, right? Wash your soap and wash it very well for about 20-30 minutes, as if you have accidentally touched the t-shirt of a ruling party. That's a slogan in Ghana, right? So we are finding a lot of interesting observations among politicians. Now, the second thing to mention is that in Kenya here, other than the politicians disappearing, and we hope that they are going to disappear for long so that we have time to think through as a nation about how to move forward as a country. The second thing is that COVID-19 is making us see how divided we are in terms of class in this country. It's bringing class dimension in a very, very unprecedented manner in this country. You note that when you go to town, Nairobi and the other urban centers, is the middle class or people with an income, people who are employed professionals, people with a salary, if I can say that, who are wearing masks, even in supermarkets. The ordinary people downtown, in many urban areas, are not bothered about masks.
No.
They are not even bothered about social distancing. They are not even bothered about many of the guidelines that are put in place. And the reason for this is simple. I've been talking to quite a number, and you realize there are very deep-seated resentments they have about Kenya's ruling elites, about Kenya's politicians, about Kenya's institutions, and so on. The first thing is that many of them say, we eat social distance. We live on basis of social distance.
We eat.
If you don't, we eat social distance.
Okay.
Yeah, we live on social distance. We don't. If you practice social distance, they live on social solidarity.
Yeah. Okay.
They eat social solidarity. It's not distance. Sorry, if I can correct myself there. Yes. The argument here is that if you distance yourself from your neighbor, you are creating basis for being ostracized by your neighbor.
Yes.
If you depend on your neighbor for day-to-day activities, cohesion, you leave your child with your neighbor, you go to your neighbor for this and that. So the social distance that is practiced by those who are privileged to do so is not something that can be practiced by the ordinary people. We are talking about water to wash their hands, we are talking about soap, but these are privileges, if I can say that. These are privileges for many people, especially in the slums, where water is very expensive compared to water in other parts of the city. So the responses to COVID-19 is revealing a lot about our own society in a manner that leaves a lot to be desired. Relating to that, I think we better underline here that it's also bringing to the fore very important governance issues. It has tended to deepen repression of the police, and actually points out the way the police have reacted to social gatherings shows that they have taken the opportunity to repress people and even to be much more present in people's daily lives more than ever before, and tells us that the police reforms that everybody has struggled to ensure that they are done effectively from 2008, that the police reforms have actually not changed, not had any impact at all.
Yes.
Probably the best thing that has happened to the police force is the change of uniforms.
Yes.
From one color to a blue color.
Yes.
That's the only significant thing that one can say has happened in recent times.
Yes.
If we see how the police are reacting to the ordinary citizens' who are caught at the wrong place during curfew, caught waiting for public transport. So, and the most interesting thing is that across Africa, seems to be happening. Uganda has become even more repressive by clamping down on people's rights than ever before, simply because of COVID-19. So it's giving the space for authoritarianism across Africa. So as an epidemic, if I can say that, because yes, it's pandemic because it's traveling from one country to another.
Yes.
But as an epidemic or a disease that we should be worried about within our own boundaries,
yes,
the responses seem to be cut and paste from the West.
Yes.
Or what has been done in China,
yes,
in Europe and America. And I think that is where we are failing as a society. Now, I'm raising that simply to demonstrate again that our institutions of governance, both political and administrative institutions in this country,
yes,
seem not to have actually studied the responses to an epidemic of this nature.
Okay.
The countries in the West are going for lockdown because they have very high levels of urbanization. And therefore, lockdown is accompanied also with a lot of services. They provide a lot of services. You can go to a supermarket, get what you want. You can do this and that. Telecommunication infrastructure is in place and so many other things. And unemployment levels are not that high. When we start thinking about lockdown, curfew, and other measures within our context,
yes,
it sends very wrong signal. It means that actually we have not studied the nature of our society to ask what is the most appropriate measure that we should have. Now, you can imagine having a curfew in the rural areas where people sleep at 8 p.m. because they have done a very hard job.
Yes.
And they must wake up at 4 a.m. to milk their cows and take their cows to a market center by 5 a.m.
Yes.
Our level of urbanization is not as high as in Europe. So my argument is that some of these measures that we have taken also are measures that have not really been reflected upon, and I don't think we have brought our sociologists, our economists, our psychologists to really tell the government, look, as professionals who have faced epidemics before, we think this is the thing we need to do.
There are those who are arguing that the sheer scale and impact of the economic contraction that is underway, the sort of the political discombobulation that you're describing, and then the social disruption that is underway, means that even when we have dealt with this pandemic, epidemic at the local level, life will not return to normal. And I'll be very interested in your reflections of what life will look like. Let's say, they're saying maybe 6 months to a year before they find a vaccine. And so this, until this infections are managed, it could be some months that we are living in these sort of new restricted arrangements. What happens to, we were talking of a referendum this year, those Tanga, Kieleweke, building the BBI, those were the things that Kenyans were preoccupied with. And all of a sudden, it's as if somebody has pressed a giant political pause button. Is it a pause or is it a stop? And when the finger is lifted, will things just start up again?
John, when we were young, as political scientists at the University of Nairobi, we used to experiment with a lot of theories. We'd read theories and then look at them very quickly and see what they imply for the society. And one thing that was certain those days, and not a long time ago, was that we came to realize that every crisis, especially a crisis that takes political forms, produces different types of leaders and cannibalizes, if one can say that, cannibalizes institutions, cannibalizes leaders who fail to respond to the moment of the time.
Okay.
And this coronavirus is likely to be that particular kind of a crisis that is going to cannibalize our institutions and our political leaders.
That's very, very interesting. Can I provoke you into a bit of speculation into which institutions do you see being degraded, and where may we where is it that we may have started to see the glimmers of new kind of leaders coming to the fore?
To begin with, so far we have not seen our national parliament, whether the Senate or the National Assembly,
that's true,
emerge to give direction.
That's true.
They have taken the idea that the reason for that is because they cannot physically meet. And again, many people say that it's because these people are afraid of death more than anything else. But governments everywhere in the world now are using teleconferencing, Google Meet,
yes.
And this is a very simple thing to do. We would be seeing them giving policy direction or providing policy guidance, if one can say that, or debating certain issues that require. But our national parliament is the first institution that actually will come out of this crisis fairly weakened, if I can say that. Yes. Let's also not forget that the national government ministries are also showing a lot of incoherence in how they want to approach devolution. We may come out of this crisis with the devolution of healthcare highly impacted negatively by coronavirus, because we have seen the National Minister of Health trying to take over, claw back some of the gains on devolution, which is not a very good thing, because you cannot appropriate a crisis of this nature to weaken institutions the Constitution has already made. So I'm simply saying even our own Constitution itself may actually be impacted negatively by how we respond to this particular crisis. One can go on and say that this is the time for vigilance. We have already talked with you about repressive nature of the state itself, and how that one seems to be deepening and producing the opposite of what the WHO guidelines about social distancing should be. The police and how they are managing crowds is producing completely different type of results. So I'm simply saying that when I look across the board, there are some institutions that will come out of this crisis weaker. And if, and God forbid this, if we have many deaths like what we are seeing in US, Italy, and Spain, I don't think the current crop of Kenya's leadership will survive that. Not survive physically, but I don't think people depend on them again for direction. New leaders will emerge and fill that particular void of incompetence and mediocrity, if one can say that. If our leadership shows mediocrity and incompetence, like Trump has done in US, very, very fast, that void is going to be replaced by those who will show direction and show a very coherent way of dealing with it. Already we have seen some county governors coming out very strong in terms of preparedness in their counties. But it's a question of wait and see. If the crisis continues to deepen, I think we are going to see a great turnover at election time of these leaders. People not have time for them again. But let's also not forget that the churches,
correct,
and most of the Catholic Church, if I can say that, will come out of this crisis more beaten than ever before. And it's simply because of how all of them how some of them reacted in the early days of the crisis.
Correct.
Not giving a care to the fact that people are likely to suffer when you congregate. The Pope himself demonstrated there is a need to do a mass alone to avoid infections. But our Catholic Church disowned the guidelines and went against what the government was putting in place and proceeded on with masses in the initial days. Other churches also did almost the same. And I think evangelicals are going to come out of this with a lot of losses because they have been preaching prosperity gospel.
Yes.
Now, no matter how many pay bills they have, people have nothing because of economic challenges people are facing, even tithing. It's not there anymore. And people are going to question a lot, even Holy Communion that has been given, and people have been always told that you must have Holy Communion, even that one is changing. People are realizing, asking hard questions now. But this coronavirus has made people do things that have never been done for the last 2,000 years in church. So it's a moment where people are going also to the basics, not only in terms of political institutions, but also questioning very hard about what do we need to do about religious institutions. In other words, it's the time to call to order all institutions to provide public goods. Don't forget that even the way people bury their loved ones has changed.
Has changed. That's right.
You can't have a gathering of more than 15 people. And you can imagine, even if you are a polygamous family, you are being told to make choices. So coronavirus is having impact even at the institutions of culture. Cultural institutions and values are being called to question. So we are not in a normal state of being. We are in a new abnormal situation, and it's going to produce new normal and very different types of direction as we move into the future.
One of the challenges that has faced many African countries that are still developing has been just weak state capacity, just a weakness in the capacity just to deliver public goods to citizens for a variety of reasons, just lack of trained human beings, corruption, incompetence, a whole range of issues. And that causes one to pause and ask what the political impact of this will be across sub-Saharan Africa in terms of the stability of nations and their capacity to be able to survive this pandemic if it reaches those proportions that we have seen in the US, in Italy, in Spain. Could we be talking of state failure in some countries? And then the flip side of that, the challenges that you're saying this pandemic presents us with, does it also present an opportunity for us to reimagine and to rethink the design of the state in countries like Kenya, Zimbabwe, etc., where we have essentially apartheid colonial structures still in place that so far have seemed fairly impervious. It said one of the things this crisis has shown us is the failure of police reform. But the Kenya police was not designed to serve the people; it was designed to protect a few settlers. And am I being overly optimistic in thinking that this also is also an opportunity to make some positive changes?
Let me begin by pointing out that actually it depends on the magnitude of the impact of the crisis in each country.
Yes.
Where the crisis is going to have very deep consequences on both the economy and other sectors of the society.
Yes.
We are going to see people demanding reconfiguration of their state. We are likely to see uprisings in some countries, depending on how the government is going to respond to the crisis. If there is lockdown in a country and the poor people will be going for days without livelihood, we shall see more people getting into the streets to demand resignation of the government. There are already countries that were suffering fragility even before the crisis. Those countries do not have very good health system. Now, if the number of deaths increase, it's going to have a lot of implications for their own political and governance systems.
Yes.
Togo, for instance, you can see what's happening there. We have seen countries like Uganda that were preparing for elections next year. Already someone has gone to court, I think in Uganda, I don't know whether the matter has been resolved, asking that the elections be postponed for another 5 years because of coronavirus, right? It's these small things that will completely overwhelm existing governments, and depending on how the government will respond to them, we are likely to see uprisings that will even lead to some of the governments in Africa being toppled. But even if that does not happen, in our context here, what I see happening if there is inadequate response to the challenges ahead is a total overhaul of our political institutions, and we are likely to see many politicians losing their seats in the next election, and very new leaders coming into being. And they'll be coming simply into place because they will be associating with public goods rather than self-interest. Any politician now who starts behaving as if they are much more interested in self-interest and promoting political capital, using this crisis for political gain, will be the loser. Will be the losers again simply because this crisis actually is having a lot of consequences on ethnic profiles of this country. This crisis does not respect a Kikuyu or a Kalenjin or a Luo. It treats everybody equally.
Yes, yes, that's true. That is true.
Yeah. So whether one has been supporting Kileweke or Tanga, the crisis is going to have a common impact, a similar impact on everyone, and those divisions are going to be dissolved. And a leader who comes and writes on dissolution of those particular divisions is the person that Kenyans are likely to go for if the crisis continues to have a lot of impact in the society. Mm-hmm. It does not matter who has been leading in the past in terms of politics. Those people are likely to be swept aside if we have more negative consequences from this crisis. I have seen in social media some people saying they would like this crisis to be protracted in order to change the nature of our institutions and our politicians to be impacted upon. Oh yes.
That's a high cost, but all change is painful. Just a final question, Prof. Over the last 30 years in particular, governments across sub-Saharan Africa, Kenya being one of the leading ones, have implemented policies that have seen the state withdraw from taking up a leading role in investment in education, in health. There's been this, we bought into the idea of this minimalist state, and that the market is more efficient than everything else, and that these incompetent, large, corrupt states should be shrunk down and let the private sector do more efficiently what these corrupt states cannot do. Yet, when confronted with this crisis, the sheer scale of it has shown that it requires the state to be involved in the provision of health, the provision of education. I look very much at sort of the different responses in a place like Britain, where the Prime Minister has gone to a local hospital when he unfortunately became infected with coronavirus, and in places where the health systems are more fragmented, we can see already that more of the poor people, more of the minorities are dying in parts of the US where there were different health systems. So what does this mean for the entire development model that we have been implementing so enthusiastically for 3 decades now?
This means that actually we need to go back to the basics. I think we have said before that there is no single institution, there is no single sector of the economy that is not negatively impacted upon by the crisis. Maybe with a caveat that only the telecommunication industry seems to be doing exceptionally well, because that's where now the investments have shifted to in the last 3 months.
Yes.
Building very strong capacity for networking through teleconferencing, for instance, and so on. But all the basic developmental infrastructure that we have had, people are questioning the developmental models that we have had before. I think everybody is going to go back to the basics. One thing we know for sure is that traveling is not going to be easy from now onwards.
No.
This crisis is going to have another impact like September 11. 9/11 is going. 9/11, we are dealing with its consequences in terms of security. There is no single airport you'll go to today and travel the way you used to travel before 9/11.
No.
You are freezed completely. You remove your shoes. They have invented machines where they will have to check X-ray machines in spite of radiation and so many other things. I believe COVID-19 is also going to have its own impact. Traveling is not when you travel to Britain and you have 14 days of quarantine before you are released to a conference, right? So the developmental models and how we shall be investing in public, for public institutions, the role of the markets, the role of the private sector, and the role of the state, both of them are going to come to increasingly a lot of scrutiny as we move forward. I think many countries are not going to let the markets dictate the future direction alone.
No.
Because we have seen that where there is a heavy investment by the private sector in private healthcare, the poor are not reaching best care at this particular time. Even in our context of Kenya here, the rich are buying ICU beds and putting them at their homes.
I've heard that.
I've heard that also. And the question to ask is, are the doctors going to pay attention to the private individuals in their homes?
Yes.
Or to the poor in Kenyatta National Hospital?
Correct.
So all this, after this crisis, I think we are going to reflect a lot on the model of investments in public infrastructure, the role of the private sector. We are going to question very hard the kind of models that we have had for development. Just the same way people are going to question political leadership. We did mention from earlier that we have had the Kieleweke, Tanga, we had discussions on referendum, we had BBI. I don't think there is any leader who is concerned about his future career who can mention those concepts anymore and survive this crisis. I bet if anyone talks about BBI now or referendum, the backlash is going to be heavy.
One final question, Professor. Karuti, you've been a public intellectual and an academic all your life, basically. And we had reached a point around the world where experts, academics, the academy itself had come to be a space that was frowned upon, that governments divested from. Even when I look at the Nairobi University where you are, and when the Nairobi University that I used to go to in the 80s is dramatically different from the one that we have now. in terms of just capacity. It's much less. You have a lot more private sector buildings named after rich individuals and foreign governments. There has been an anti-academic, anti-intellectual kind of environment created by the political class, not only in Kenya, but around the world, and hostile to experts. Yet I would like to think, my immediate observation is that I as in doing this series on coronavirus for the Elephant, I've spent my time looking for experts and academics like yourself around the world to comment on it. So are we on the verge of the rebirth or the return to relevance of our academic, intellectual class in our societies as we seek for answers of how we're going to define our new reality in the new normal that coronavirus is bringing?
Let me underline two things here. African governments have no respect for experts. They have no respect for professionals. And that's why they have been underfunding public universities. Except in South Africa, I do not know any other government in Africa that gives money to its own academia for research that they can use for development policies and so on. In Kenya here, matters got worse during the Moi period. The Moi regime actually is the one which completely cut the link between academia and the public and other public institutions and government ministries in the past. My own department, my own institute, IDS, used to actually produce national development plans. Used to advise the Minister of Planning, and I used to do things together with the Minister of Planning across all sectors to inform government policy making and implementation. And the same can be said about universities across Africa. So it's not the structural adjustment program that created this disconnect. It's the regimes that came later on to realize that if we depend on experts, I think we cannot satisfy our political needs of staying in power the way you want to stay in power. We cannot deliver on self-interest the way we want to deliver on self-interest. So many governments depend on the information from their national security intelligence, information that is not drawn using science. So many governments in Africa depend on rumors to make their policies, if one can say that, and ad hoc collection and analysis of data. And that's true of many governments, except I think the government of South Africa, because I'm saying that because I'm privy to the fact that the government of South Africa actually funds all universities to produce research that is relevant to government policy making and implementation. It should not surprise anyone to know that actually, even in Kenya here, Kenyan experts produce research work that is consumed more by governments in the West than our own government.
That's true.
Americans, the Danes, the Swedes, the British, most of their approach to development in sub-Saharan Africa is informed by data by African scholars. And our African governments do not bother about such data. Governments in the North also depend on their universities to know what to do about even pandemics of this nature that we are talking about today. Their interventions are informed by what their universities advise because they use science to do so. Yeah. But in our context here, I think we need to underline very carefully that we completely forgot about the role of the expert. But we have seen that in recent times, I think as a result of this coronavirus spread, we have seen increasing tendency of people picking telephone and asking experts, what do we do? This has never been there before, by the way.
Yeah.
I've seen quite a number of commentaries by my own colleagues at the University of Nairobi taking a lead in some of these initiatives. So we hope that this is a new beginning to depend on experts' opinion rather than anecdotal rumors by politicians and others to make policies. And I am serious that in Africa, many governments make policies using ad hoc data, national intelligence data that is collected not in a scientific manner, but they have ignored science throughout. And you can see that on basis of when you look at the design of quite a number of development projects and how they fail.
Thank you. I mean, on that, I feel that is a quasi hopeful note for our academy.
But let me end also that kind of comment that I made, because you asked about the University of Nairobi.
Yes.
There is an emblematic symbol of the University of Nairobi called Taifa Hall.
Yes.
Taifa Hall is renowned throughout Africa, actually globally, as a place for debates, all the debates in Africa about even transformation of Africa, development initiatives in Africa. That was a place for very huge debates in the 70s and the part of the 80s.
Correct.
Again, it's the regimes that we have had from Moi to present that have never tolerated economic freedom and freedom of expression in particular, that led to the university leadership fearing to open such spaces for big debates about transformation of the society. But we can say that with the current leadership at the University of Nairobi, I've seen increasing tendency of saying, let's debate. And I can tell you for the last 2 years or 3 years, I've not seen anyone being stopped from giving a talk at the University of Nairobi, which is something that is positive. Except that because people are used to the old ways of doing things, very few people have appropriated this kind of opening to say, let's actually debate these kind of things.
Right. Thank you. Thank you very much, Karuti. We hope that this crisis serves to give further momentum to that kind of positive development. I wanted to say asante sana for your time. It's always a pleasure to sit and chat with you. I'm sure we'll be chatting again. For now, all I can say again is asante sana. Stay safe.
Stay safe.
And I'll be calling you. This is now the time to call the experts. I'll be calling on you again as we observe continuing political and social developments in Kenya as a result of COVID-19. Thank you very much, and have a good evening.
Have a good evening as well, John, and I hope to listen to you again and have a discussion on this. We are living on unprecedented times, and we hope people are going back to the basics and think about how to supply public good.
Correct. Absolutely.
Thank you.
Thanks, Karuti. Have a good evening.
Good evening, John. Thank you.